Hi, this is attorney David Gibbs with the National Center for Life and Liberty. At the NCLL, we've received inquiries from many churches and many schools and preschools asking a very simple question. What do we do when we think someone might have COVID? And what are our testing options? Do we have to go to the health department? Do we have to go into the medical universe? Or are there some things that we could handle ourselves? At our ministry, we went to work on partnering with a testing organization that provides the best rapid response test kits that are being used all across the nation. And we've now been able to make them available to you to use in your ministry if you were to choose to do so. They come in boxes of 20, but an individual test is $17, and then the entire box is $340. And if you're interested in multiple boxes or a more volume discount, you can visit our website at ncll.org. And if you just look there for the test kits, you'll be able to find your way in. And there'll be links tied to this video as well where you can look for the volume discounts. Now, somebody says, well, if I get a test kit, what exactly am I going to get? Well, it comes with some different pieces. So this is the swab, and these are sterile, and they are what are administered to the person that you're testing. Then once you get your sample, you put it into here, and this is then where the liquid is combined with and shaken through. You then take the liquid and you put it into the testing kit, and this is where you're going to get your results. Now, this is a brand new test, so there's no results. But one that after about 3 to 5 minutes, you'll notice this testing kit has one line. Now, one line is a good sign. That means you are not positive for COVID. If this testing kit showed 2 lines, then that would show that according to this rapid test that the person did have the coronavirus and is testing positive. Now, people are asking, well, Mr. Gibbs, this is very handy. This will be very useful for us. But what are the legalities of us administering this test if we have a school? Well, we would certainly recommend that you use the school nurse if you have any medically licensed people on your staff, and they can get verbal permission from a parent and they can administer the test. And again, because it's invasive in the nose, we certainly would recommend that someone have some medical background in testing. If your school doesn't have a school nurse, then what we would recommend is that you make the kit available to the parents. A parent could certainly administer the test and get the results back for their student. And we do have a consent form that we would recommend that you use to get permission, but you can get verbal permission over the phone, but a consent form in writing is always the best approach because with all of the sensitivities over health information and the treatment of children, that is the most prudent approach. Now, again, if you don't have a school nurse, you can send it home with the parent. Now, somebody may ask, well, what about the legalities of administering the test if we're just a church? And what we would recommend against is administering the test if you do not have a medical professional on staff. So we don't recommend that you have, for example, a secretary or a pastor administering the test to another individual. The test can be provided to the employee to do at home. They can do it themselves, or they can have a family member or someone help them. They might even have a friend or someone who is medically trained to assist. But we would recommend that the church not be in the business of coordinating medical care. That's clearly outside the scope of what you're called to do, but we don't want any unnecessary liability coming on the ministry. But certainly within most congregations, there's some friendly nurses or staff or others that may be able to help the employee or the individual administering the test. Now, the test is administered. What next? Well, you get a result back pretty quickly. If you get the completed test back showing that it's either positive or negative, you want to write down the results. You want to document it, show the time, and make sure that you are then able to verify that this person had some symptoms, we tested, and they tested negative. Or the reverse, they tested positive. Now, if they test negative, what you would be able to do is let them resume their activities. Obviously, if they're feeling okay, they could return to school or church as usual. They could return to work. If they're positive, you need to follow your quarantine policy. And for many organizations, that's a period of time or a number of days without symptoms. But obviously, a positive COVID test, that individual should stay away from others so there's not unnecessary spread. At the NCLL, we would recommend that you update your COVID-19 policies in writing to reflect the availability of the test. Now, you may say, well, what should be in our policy? Well, when do people take the test? Certainly when they begin to experience symptoms. And then what will the test do to impact their status with your organization? And as we outlined before, if they test negative, there would really be no need for quarantine unless they were not feeling well. Now, if you have any additional questions, our team at the NCLL is available to you, and we're providing this resource with the goal of allowing your church, your ministry, your school to be able to get this information without being totally dependent on slow test results or government resources, but being able to make some of these determinations within your own organization. I believe firmly that if you give good people good information, guess what? They can make good decisions. And at the NCLL, we want to empower you to maximize your ministry and do what God's called you to do.